Good day, class. In this video, we are going to talk about the menopause syndrome. Menopause syndrome is quite commonly happens in ladies. About 2/3 of ladies will experience some type of symptoms. It refers to the period of time approximately 1 year prior to the menopause and is associated with the dysfunction of endocrine system. The symptoms includes hot flashes, sweating, irritation, dizziness, tinnitus, palpitation, insomnia, weakness in the lower back or knees, etc. Apart from these symptoms, sometimes the patient may present with other symptoms. Other symptoms are related to all different kinds of symptoms, and this patient will also can feel this kinds of anxiety. Anxiety also as a result of menopause. Menopause syndrome was recorded in 伤寒杂病论. The author, Zhang Zhongjing, described that a lady presents with 脏燥. 脏燥 is a term in Chinese medicine, but he described the symptom. The patient sometimes feels sad, sometimes feel she would like to cry. And the feeling from others, when others see this patient, it seems like the ghost control the patient. So sometimes cry, sometimes happy, sometimes sad, sometimes happy, sometimes cry, sometimes laugh. So he described the sudden changes of these symptoms. This is actually indicates the changes of emotions. So the common symptoms here, I didn't write down here the emotion changes. You will see in the main symptoms, we have something related to emotions. So Zhang Zhongjing already described the common symptoms of menopause, and he proposed one formula, 温经汤, to treat. The most common reason for menopausal syndrome is due to kidney deficiency, although this kidney deficiency will relate to the heart, the liver, and spleen. So mostly the kidney deficiency, either kidney yang deficiency, kidney yin deficiency, or kidney yin and yang deficiency. But this deficiency will result in dysfunction of the heart, the liver, and spleen. The heart dominates the mind. The heart houses the mind. That's why when I say the emotion changes, sometimes sad, sometimes happy, sometimes feel like crying, sometimes feel like laughing. So the sudden changes of emotion that's related to the liver and the heart. That's related to the emotion and the mind. That's why our treatments also will focus on the kidney, either kidney yin or yang or both. And then we're going to focus on some other symptoms. Palpitation related to the heart, emotion changes related to the liver, also related to the heart, irritation related to the liver, so that's how we identify the location of diseases. And this will help us to select the points. Same in 伤寒杂病论, the author described the patient, at what age the patient will present as with all these symptoms. He described that ladies around the age of 50, the 50. The reason for this is also in alignment with the description in 黄帝内经. We mentioned that the development of female with the number 7. For the first 7, start to grow teeth. From 17, menarche. For 14, menarche 27. From 21, mature, 28. And then until 49, 77. So it described that the last menstruation will happen in the last 7 years, 49 to 56. So this is Also similar to today, the last menstruation may happen around this period, maybe a few years earlier or a few years later, but more or less at the age of 50. So this is the description from the classics. The symptom of this problem, the deficiency, especially the kidney deficiency, is the dominance pathogenesis that you need to focus on. Kidney deficiency. When you see the symptoms, you will also see many symptoms actually related to the deficiency: heat, irritation, hot flashes, sweating. These are all related to kidney yin deficiency. So in your treatments, you're going to tonify the kidney yin. Hyperactive liver yang. We have mentioned previously, the hyperactive liver yang is due to kidney yin deficiency. So the patient presents as relatively lack of yin fluid in the body. That's why the yang becomes relatively higher or more yang in the body, hyperactive liver yang. The treatment for this, we're going to reduce the heat. In the meantime, we're going to tonify kidney yin. So this hyperactive liver yang is very different from liver fire, which we're going to clear the heat. Dysfunction of the spleen, the heart, the liver, all may be related. So the symptoms is what I mentioned, emotion. The emotion also can be affected. The emotion related to the heart, related to the liver. Palpitation is also a common symptom. The most common symptom for females is hot flashes and sweating. The reason, the explanation for this is because of the kidney yin deficiency. So the patients have less kidney yin in the body, and the kidney yin, one of the functions of kidney yin is the kidney stays at the bottom, the heart stays on top. The kidney yin needs to go up to cool down the heart fire, and the heart fire needs to move down to warm the kidney. So that's the theory we study in the yin and yang theory. Something stays in the upper area have the trend to move downwards. Something stays at the bottom have the trend to move upwards. This is the situation that we describe in yin and yang theory. When you see from the nature, you can see the water and the clouds in the sky. The clouds will go down in front of rain, go back to the sea, to the ocean. So something stay on top, need to go down. The sea water will go up and transform into the clouds. So this is the trend of yin and yang. When a patient suffers from kidney yin deficiency, kidney stays at the bottom. Kidney yin have the function to move outwards to cool the heart fire. So in this situation, the patient suffers from kidney yin deficiency. The lack of yin, which means this patient will not have enough fluids to cool the heart. And in this situation, the patient will have excess heart fire or excess heart heat. That's why it will result in palpitation. Similar explanation can be used for liver caused hyperactive liver fire or liver yang. So this is the explanation, the pathogenesis explanation for palpitation. In future, when you see a patient in clinic, why this patient will present as sweating? The sweating, especially in the upper part of the body. This is due to the heat, the kidney yin deficiency, the heat. The kidney yin cannot control or balance the heart fire and cause palpitation, cause the dysfunction of the heart, result in palpitation. The heat in the upper part of the body will force the sweat to go out of the body. That's sweat. deficiency. On the other hand, also the sweating, on the other hand, also can form qi deficiency, because kidney deficiency or kidney qi deficiency, the superficial body lack of the function, the qi function, wei defensive qi function, to control or to hold the sweat within the body. That's why the patient presents as sweat. That's why in your treatments, you may focus on reducing heat from the you can focus on reducing heat in the meantime to tonify kidney yin, but you also can try to strengthen the wei defensive qi to stop sweating. These are the different symptoms related to different syndromes. The treatment principle: nourish level yin and kidney, regulate Cong and Reng. As you can see in these few videos, we always mention about Cong and Reng meridians. The reason is because these meridians very closely related to the uterus. Apart from the reason that I have mentioned, the Cong meridian is the sea of the blood. Another reason is also because Cong and Reng meridian, the origin of Cong Reng meridian, also Du meridian, is actually from the uterus. That's why there's one thing I think we didn't mention in the infertility is the treatment for infertility. You also can focus on Du meridian, but the Du meridian is very similar. The treatments to the tonify yang, because tonify kidney yang, you also can select from the Du meridian. Du meridian is the sea of yang meridian. So these three meridians, they origin from the uterus. That's why it is very important for anything related to menstruation, that's related to uterus, infertility, menstruation, for Cong meridian, for Reng meridian, especially Reng and Du meridian. Reng meridian can be something to tonify the yin. Du meridian can be yang deficiency, but Reng meridian, such as Reng 4, Reng 6, can tonify yin. You also can use reinforcing technique. You can use the Moxibustion to strengthen the heat in the lower abdomen, which also can strengthen to warm the uterus. This is one of the reasons of the infertility. But for menopause syndrome, the patient will suffer from deficient heat. So in this situation, we will use less Moxibustion. The points that's commonly used, you can select from the Reng meridian, the spleen meridian, such as Reng 6, spleen 6. The spleen 6 can be used for three yin meridians: kidney, spleen, and liver. And kidney yang deficiency, as you can see here, kidney yang deficiency, Du 4, Mingmen, the gates of life. So this is on Du meridian to tonify kidney yang. Du 4 also can be used for infertility. Mingmen, the gates of the life, infertility, to conceive. That's also the life. So you also can focus on the kidney, Du 4, especially for kidney yang deficiency. In this video, we mainly discuss the menopausal syndrome. The diagnosis of this syndrome is very important related to the age of the patient, the situation of the period. So when we diagnose menopausal syndrome, we must differentiate from dizziness, edema, or even palpitation, depends on the symptoms. For the other diseases, it does not happen in the specific age. Apart from these diseases, we also need to differentiate with some tumor. the possibility of tumor. So especially at this age, the ladies at this age, if the symptom comes and goes, accompanied with abnormal menstruation, abnormal cycle, or abnormal volume of the blood, you must, apart from your treatment, you must advise the patient to go through under examination to exclude the possibility of tumor. So the examination that you can advise, the most common one or most simple one will be the ultrasound for female reproductive organs, uterus, ovary, etc. The treatments for menopausal syndrome, you're going to base on the syndrome differentiation. But in the meantime, you also need to advise the patient to relieve the emotion, such as to exercise. This problem, the menopausal syndrome, in some patients may recover quite quick. It can be a few months, but sometimes it's also very long. It can be a few years, even more, between 5 to 10 years. So the duration of the disease varies a lot from individuals. Thank you for your attention.